Hello everyone, my name is Pema and I'm here today with Mary, Jinghao and Faya. I hope you all had a very wonderful day. Today we are very pleased to present a brief overview of the clinical handover. In this presentation, we'll define what clinical handover means, explain its significance together with barrier and requirement of effective handovers with the impacts of poor clinical handover. We will also demonstrate how the effective handover differs from the ineffective handover. Clinical handover involves exchanging information and transferring responsibility for patient care from one healthcare personnel to another. A good handover is crucial in clinical setting as it significantly impacts the quality of patient care. Various handover tools are used across the healthcare settings, and today we will focus on the AI tool, which stands for Identify, Situation, Background Assessment, and Recommendation. It closely aligns with the NSQHS, particularly Standard 6, Communicating for Safety. We will use this to show the difference between the effective and the poor handovers. My friends now will provide a detailed explanations of the handover, its important and related topics.
Clinical handover in nursing is a vital process that ensures the continuity and safety of patient care across shifts, departments, and healthcare teams. In Australia, the significance of effective handover is underscored by national standards set by the Australian Commission of Safety and Quality in Healthcare. These guidelines emphasize structured communication protocols to minimize the risk of clinical errors. When followed, handover processes provide nurses with a consistent method to convey essential patient information such as condition updates, treatment plans, and clinical changes. Effective handover plays a key role in patient safety and promotes high quality care delivery. Despite its importance, several barriers can compromise the effectiveness of clinical handover. Variations in practices across healthcare teams often lead to inconsistent communication, increasing the likelihood of critical details being overlooked. Time constraints, particularly in high pressure environments with rapid patient turnover, may result in rushed or incomplete handovers. Language barriers, including the use of medical jargon or unclear terminology, can hinder comprehension among team members. Environmental factors, such as a noisy or distracting setting, may further reduce focus and information retention. Additionally, limited access to integrated electronic health records can delay the transfer of essential information. Cultural factors, including hierarchy dynamics within teams, may also prevent open communication, especially among junior staff. Overcoming these barriers requires structured communication frameworks like ISBA, regular training sessions, and investments in technological solutions that support efficient and accurate information transfer.
Hello everyone, my name is Jinghao and I will talking about impact of the poor clinical handover and the requirements for effective clinical handover. Poor clinical handover refers to the inadequate communication and transfer of the patient's information between healthcare providers. In Australia, ineffective handovers put patients' lives at risk, including the medication errors, delayed retreatment, and patient harm. Firstly, the poor clinical handover can lead to the medication errors in patients, such as the repeated dosing or dosage errors, which can lead to the drug poisoning or damage to the body organs. Secondly, poor clinical handover may result in more extended hospital stays for patients, maybe increasing the risk of the patients, the complication and financial burden for patients. Finally, a poor clinical handover can cause the invisible harms to the patients, such as increased patients' mortality or morbidity. Clinical handover is a vital component of safe and effective patient care. Effective clinical handover ensures continuity of the patient care, enhances the patient safety, and using a standalone communication method. Using the structure and standardized handover frameworks such as the ISBAR can improve the patient outcomes. ISBAR suits many clinical situations, such as safety changes, inter-hospital referrals, and medical emergencies. This method is ideal for oral communication, written reports, and referral documentations. For example, using the ISBAR in Mr. Crocker's case, we can learn the patient's name, date of birth, current condition, family and medication background, assess what went wrong, and what should be done to correct the situation. As Standard 6 of the NSQHS standards mentions, communication is a key issue in providing safe and high-quality patient care. Inadequate communication during the handover can lead to the inappropriate treatment and poor patient care outcomes.
Sorry, so this is Ashley, Bronte, is it? Yeah, so this is Bronte. She's a 54-year-old. She's here because, of her CKD. Stage 3 is getting worse and stuff. She's had some weight gain and she's having trouble with her breathing. She's on furosemide, 40 milligrams twice a day. Also, she can walk around fine. We've been keeping an eye on her fluid levels and kidneys, obviously. Yeah, so she has CKD, stage 3 and hypertension, family history of stuff like kidney failure, COPD, and hypertension. She lives in Prosperon with her husband and kids. She's on Ramapril, metoprolol, and I don't really remember the last one. Vitals are all good, I think. Blood pressure's a bit high, oxygen stats are normal, but she's a little short of breath. So we gave her some oxygen via nasal pumps. I've been tracking her fluid levels and it's, whatever. Creatinine and EGFR are probably high, so you should keep an eye on that. She's on a special diet, low sodium, and no real issues except the swelling in her legs. So be careful, as she's potentially at a risk of falling. I've done some stuff about that, like the falls risk. So the recommendations is to keep her on furosemide, 40 milligrams twice a day, watch her weight, make sure she sticks to her fluid restriction, also check her electrolytes and meds, keep track of her blood pressure and her breathing. She's doing okay though, or make sure she's not moving a lot to help with the swelling. Okay, great. We'll leave now. Thanks. Bye.
Okay.
Hello, Bronte. Is it okay if we start our clinical handover? Yeah. So full name, date of birth, and URN.
My name is Roger Coulter. Date of birth is 1970.
Yeah. Awesome. Thank you. Great. So Bronte, this is your nurse Mary and nurse Vivian, and we're just going to hand over important information about your care. So I was looking after Bronte Crocker. She's 54 years old with the URN number of 658244. And just double checking, no allergies. Awesome. So she was admitted yesterday due to a recent worsening symptoms related to her chronic kidney disease, including significant weight gain with about 7 kilograms in the past month, with edema, particularly in her feet. She has shortness of breath and she started on furosemide 40 milligrams twice daily orally to manage her fluid overload. continues to mobilize independently. She has a GCS score of 15, and her condition requires close monitoring, particularly her fluid balance and renal function. Bronte has been diagnosed with chronic kidney disease and has moderate renal impairment and hypertension. She has a family history of hypertension, chronic obstructive pulmonary disease, and kidney failure. She currently resides in Hosperon and with her husband and 3 children. Bronte's currently taking ramipril, metoprolol, and furosemide orally. So I did Bronte's vital signs as of 30 minutes ago, so this is the most recent. Her blood pressure seems to be at 150/80, heart rate 88, respiratory rate 20, SATs 95, and temp at 8. She has edema present on both lower legs, and treatment has been initiated. In terms of respiratory assessment, she's experiencing shortness of breath, so I've positioned her upright on the bed and given her oxygen via nasal pumps to help with her breathing. I've just given her about 2 liters every minute. And recent blood tests indicate renal impairment, which is contributing to her fluid retention and edema. So I've implemented a strict fluid balance monitoring, fluid balance monitoring, and ongoing monitoring of her EGFR and creatinine levels will continue to assess her kidney function. I've also ensured she's on an ACE inhibitor to manage her high blood pressure and support kidney function. Dialysis is still under consideration depending on her response to treatment, but weight gain monitoring was done to track fluid retention, and I assessed her respiratory rate within 30 minutes to monitor any improvement. Bronte is following a strict CKD specific diet, which is low sodium, potassium, and phosphate, and is adhering to her fluid retention. I've noted a potential falls risk due to edema in her legs and have taken appropriate precautions. And lastly, I've completed a neurological exam to rule out any complications. So my recommendations for you is to continue furosemide 40 milligrams twice daily and monitor daily weight for signs of improvement or worsening fluid retention. And to continue fluid restriction, closely monitor her intake, watch for any signs of electrolyte imbalance or side effects for furosemide, and regularly check her blood pressure and respiratory status due to recent shortness of breath. I recommend to follow her low sodium diet and to encourage light movements to help with the swelling in her legs. Any questions? No? Alright, Bronte, we're going to head out. Here's the call button if you need anything. Yeah. Awesome. Thank you so much, Bronte. See you later on. See you.
We are at the end of our presentation. As we conclude our presentation today, we would like to underscore the significance of effective handovers in providing quality care to patients. Poor clinical handovers can lead to crucial information being overlooked, potentially resulting in harm to both patients and the healthcare professional. It is vital to ensure that every detail is included in thorough handover. We have demonstrated the contrast between a good handover and the poor one, highlighting the essential consideration to bear in mind during the handover process. We sincerely hope that you have absorbed the key messages we aim to communicate, and they will serve you well in your nursing journey. Thank you very much. We hope you all had a very wonderful day.